Ready? One, two, three. Welcome everyone. This is Kiana from Famalao'an Rights. This is a very special edition of Famalao'an Talks. Today we have Dr. Shanti Guerrero. Dr. Shanti, if you want to just go ahead and introduce yourself, who you are, what you do, we'd love to know.
Okay, hi everyone. I'm happy to be here with you guys. I'm a proud daughter of Guam, born and raised up until I graduated high school and then came out here to the States and have finished my family medicine residency and an additional year of training for obstetrics. So I'm in the Bay Area now. I work in an underserved clinic with mainly Hispanic and undocumented and African American kind of people in Oakland, and do labor and delivery in Berkeley as well for the same community. And through my work, I'm very passionate about a lot of social justice issues, and reproductive justice takes a big part of that, especially with the amount of labor and delivery and obstetrics that I do. I think I see a lot of deliveries and have a lot of interest in reproductive health.
Yeah, that's great. I'm sure the people in the Bay Area really appreciate you. This is the first time we've actually had a doctor on the show, a medical doctor on the show, and our organization, especially right now, is about informing the people of Guam, because what's really lacking here is, the spread of information about things like reproductive justice, issues surrounding abortion and things like that. So I'm just gonna ask you a couple questions that were sent to our Instagram and also that we were just curious about. Firstly, just starting with, so what are reproductive rights exactly as defined, if defined by the medical community, and why is it considered or should be considered an essential part of healthcare?
Yeah. Well, I can't say if I've ever heard a formal definition, but I think in general, reproductive justice is the option for women, or maybe better said, people who have reproductive organs, to make choices about their reproductive course, whether that be about contraception, whether that be family planning, whether that is deciding when and with who and how they would like to start a family, how they would like to deal with sexually transmitted health and prevent themselves from getting infections, or how to navigate some of those particular nuances, the decision to breastfeed, the decision to not breastfeed. And I think one of the things is that it's so important is that this is one of the medical things that everybody goes through at some point in time. Not that everyone chooses to reproduce, but it's a kind of part of the life cycle. And most people will come across a decision of what their reproductive path will take. So I think that's one where it's really important. And the other one is just that, it's a huge impact on someone's life cycle in terms of, someone having a pregnancy, that changes your life, and having a child changes your life, and that can affect whether you have the chance to do what you had planned to do, or maybe will help you do what you had planned to do, or maybe that's what you plan to do. But it's a huge impact on your life, and I think that's where the justice component comes in, because at the end of the day, we all just want to achieve the goals that we have to set out, and this is one of the ways that we get people there.
Yeah, right, definitely. And I think that's something, especially here in Guam, I think people, when they hear reproductive rights, they, automatically think, oh, they're talking about abortion. But like you said, it encompasses so many things. The option to breastfeed, things like STDs, all of those are part of this concept of reproductive rights. And for families, a lot of young girls here don't get the information they need because of the educational system here. And actually, a question we have today is to talk more about thing with the reproductive system is what exactly is a period and why do girls get their period?
Yeah. So it's a quite an interesting reason or quite an interesting thing. I get actually a lot of questions about it. And so, the kind of classic teaching is you're a woman now, you can have a baby, and that's essentially what it is. But basically, every month, once your body decides that you are qualified to reproduce, women will kind of prepare for a pregnancy. So there is a whole crazy cascade of hormones that goes throughout the month in order to make that happen. So it normally starts off with ovulation. So the ovaries have a bunch of follicles or eggs, and they will grow. One of them will kind of rupture and pass then from the ovaries through the fallopian tubes in preparation to be fertilized. While that's all happening, these wild changes in hormones is preparing the uterus, which is where that potential pregnancy would land. And so it gets thick to make a nice home for this potential egg once it's fertilized, gets really thick in the uterus, and if the egg makes its whole way after being ovulated into the uterus and does not get fertilized, then the uterus that's made this nice home just says, okay, never mind, and then gets rid of it. And that lining, that kind of nice home for this potential egg, is what comes out in the period blood. So while it is blood, it's also kind of a mixture of different tissues that have been ready and eager to have a pregnancy. And if you don't have one, then it sheds, and then the whole process kind of starts again. So that's basically it. Before you ask another question, I'd just like to put it out there. You don't have to have a period, which I think is sometimes a myth, or people get very scared that it's not natural to have a period. But that's one very wonderful side effect of a lot of birth control methods that are out there, or different a number of different things can cause no period, and depending on what it is, sometimes it's not necessary. So just throwing that out there.
Right, that's awesome. That's actually a lot of stuff that I also personally didn't know. It's a very complicated process, but I think you summed it up really, really well. And most people who get their period are young women. And we actually, before we logged on, we're talking about the concept of virginity. And a lot of young girls ask themselves, like, oh, like, am I still a virgin if I use a tampon? So what's your take on this?
Yeah. So, I think technically people think of virginity of having penetrative intercourse. And so that's normally, a male penis entering a female vagina. That's obviously does not even come close to all the many different types of intercourse that exist, and the many different genders that can be between. So that's the traditional version of virginity that you hear of. And so, other things that are not necessarily a male penis are not technically considered, losing your virginity. So things like tampons, which is something going into the vagina, so it is a penetrative thing, but is not, a sexual encounter. And that includes, I think it also comes up with pap smears. People sometimes get nervous about things like that. It's also something going into the vagina, but in a non-sexual encounter way. Yeah.
Right, awesome. Yeah, exactly. I completely agree with you. And also, something that we focus on here, obviously we're focused at Famalao'an Rights on things like pregnancy prevention, but we also get a lot of questions on our Instagram from our audience about if they already are pregnant or if they want to be pregnant. And a question that came up actually was women ask, how exactly do you know if you're pregnant?
Um, Sometimes it's very hard. So I would, I think a lot of women have pregnancy symptoms, and you probably see and hear about it, is that, some women get nauseous, some women have some cramping, some women have some breast tenderness. There's often kind of a loss of your period, and fatigue is often a very common early pregnancy symptom, but it can be really, honestly, quite tricky for people. I've had women come in who are 5, 6 months pregnant and just had no idea, just kind of thought they were maybe getting big, and, I felt, a little weird, but I thought I had gas. And so it definitely happens, and it can be tricky, especially in people who have irregular periods. It can be a little bit hard to tell. So normally, I think it's helpful to think, are you using any form of birth control? Have you had any unprotected sexual intercourse that might lead to a pregnancy? But it can be hard.
And so, a lot of girls like take things like pregnancy tests. So how accurate are, pregnancy tests? Because I know some people they'll like take two just to make sure that it's correct. So what's your take on that?
Yeah, they're really quite good these days. The home pregnancy test can detect, what they generally check for is for a pregnancy hormone that is secreted at the beginning of pregnancy to help kind of develop the placenta and the uterus. And the pregnancy hormone can be detected by these urine tests as low as like 20. So it starts from 0, goes to 20, and then women in just a few weeks of pregnancy are in the 12,000s or 30,000. So just as a context, 20 is pretty good. It's really quite good. So if you had sex and a condom broke yesterday, you probably won't have a positive pregnancy test quite yet, because it still takes a little bit of time even just to implant into the uterus. But within a few, generally like even probably by about 4 weeks, which is oftentimes the time of the next missed period. If that's positive, it's generally pretty accurate. If it's negative, it doesn't always mean that you're not pregnant. It might be really, really early. So we often will use a combination of pregnancy tests, ultrasounds, date of the last period to figure out if people are pregnant, and if so, how far along, to tell. And I think that can often surprise people, because sometimes it takes a few months to kind of really get a good sense of when the due date is, if you are pregnant. If you are pregnant, where is it? Because it's just can be really, these are like cells, like just very, very few cells. So it's really kind of hard to get great senses in the very, 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 very early stage.
Right. And you
Yeah.
mentioned earlier, if you have sex one day, the condom breaks the next day, you're probably not going to get a positive test. Most girls would turn to Plan B. So could you just explain a little bit about how contraceptives like Plan B work exactly?
Yeah. So there's kind of a number of different options for emergency contraception. And actually just maybe a month or two ago, they expanded it to make even more options, which is really exciting. And so there's kind of there's kind of the traditional Plan B pill, which is either Plan B, or Ella is another name for it, that if taken right away will help try to block both the fertilization and kind of the progression of a potential pregnancy. And so those are, generally speaking, all of these things work the best as soon as possible. So oftentimes if I don't actually know how available it is on Guam, and I'm just haven't had to come across it recently. But if it is available, sometimes it's nice just for people to fill the prescription at the pharmacy and keep it in your house, in your nightstand, because if anything happens and you forget a condom or it breaks or whatever, you can just take it right away, so that you don't have to wait and call a doctor and go to the pharmacy and wait for the prescription. And by then you're a few hours or days later, because it's less effective if pregnancy is not part of the plan. So there's kind of those traditional pills, and then there's also IUDs, or the intrauterine devices. I just happen to have a nice little example of it. So it's this little IUD, or kind of the T that goes into the uterus, and that can be also inserted as a form of emergency contraception, and then can stay as just a form of regular contraception, which is kind of nice because it can help both prevent that pregnancy and then any future ones for a number of years, depending on what type. And they just added on a few of those different IUDs that can be used now, which is really exciting. That has to be done in a clinic by a physician, so it's a little bit trickier, or a medical provider.
Right, yeah. So we actually you can buy Plan B over the counter here. And I know you can also get an IUD, although it's a little more like limited in terms of like when you can go to get it.
Yeah.
So kind of moving down now. So we talked about periods, and then we talked about preventing pregnancy. So now what I want to talk about more is, if a person happens to get pregnant and, it's an unwanted pregnancy, could you just go over a couple of different abortion methods that are available, early and then, a little bit later in the pregnancy?
Yeah. And so I think I'll just be speaking kind of more generally, since it's a little bit limited, or kind of, if we're talking specifically about Guam, the options are a little bit different. But normally, so there's in a very early pregnancy that is very sure that it's a pregnancy in the uterus, then there's generally options for either to be managed with a medical procedure, or like with pills, or with a procedure. And so they're either kind of a combination of pills that can help end the pregnancy, and then pills that can help kind of pass the pregnancy tissue out of the uterus. And that's what's called kind of a medical abortion, or medical termination. And that generally is is used up until about 11 or 12 weeks, so in that very early kind of first trimester of pregnancy, which often tends to be in the first few weeks after a missed period. So you generally have to kind of know you're pregnant and decide that you don't want to be pregnant fairly quickly, which can be challenging for some folks. And the other option is kind of the procedural termination, which, depending on where you are, can be done until quite a bit further along, where it's basically kind of, at least for the early ones, kind of in a procedure, kind of a little bit similar to a pap smear, in terms of, a speculum is placed into the vagina, and then the pregnancy tissue is kind of evacuated from the uterus by different devices, depending on where you are. And also, that the nice thing about with that is that can also sometimes, you have the option to put an IUD in right away. So sometimes people can get kind of all things done at once, like end a pregnancy that's not wanted, and have an IUD put in to prevent any future ones, and then kind of be able to move on with their life. So those are the most common. There's a lot, I think, many different methods for when you get further along, but those are the most common, and those are the ones that I'm more versed in, or more familiar with.
Right. Awesome. Thank you. Yeah. So, yeah, we talked about medication abortion a lot here and how it's difficult to really get here in Guam. You need a wife, you want a procedural abortion just because of the different laws here. Another thing that was brought to our attention was something that I personally never heard of. So I did a little research on it earlier. It's called PCOS, polycystic ovarian syndrome. So many women on island actually do suffer from this, and oftentimes it goes undiagnosed. So could you just talk a little bit about what it is, how it affects women, things like that?
Yeah, so it is definitely quite common and a bit of a tricky thing to diagnose because there's not there's kind of a few different criteria that can make the diagnosis, and a lot of them can be a little bit vague. And so, generally speaking, when I had mentioned that the at the beginning when we talk about periods, that the ovaries have a bunch of follicles follicles or cysts or eggs, they're all kind of the same. And throughout the month, normally the cascade of hormones will kind of choose one of those follicles to grow and mature, and then kind of make a cyst, and then the cyst bursts and releases the egg. Um, but what can happen with PCOS is that sometimes there's just a whole bunch of eggs, and some of them grow, and the hormones are a little bit dysregulated, and sometimes there's an egg that is ovulated, and sometimes there's not. And so it's a little bit kind of hard to work with. I think it can be complicating because of that. So a lot of women will have very irregular periods, which is a very common thing that is seen with PCOS. And then the other signs are, it tends to be the majority of the time hand in hand with dysregulation in hormones. The large majority of the time that tends to come from an imbalance of kind of the more traditional male pattern hormones, so an imbalance of testosterone in the body compared to kind of more traditionally female hormones like progesterone and estrogen. So that's something that also kind of plays into it. And I think the easiest way to probably think about it is that the main problem is the hormone problem that's causing the weird egg problem that then causes the weird period problem, if that kind of makes sense directionally. And I think it's probably so common for quite a number of reasons. In a lot of our populations, both out here on Guam, there's a lot of lifestyle issues that can dysregulate hormones. A lot of that is kind of lifestyle, like weight, food intake, things like that. So kind of it tends to be more common in heavier set women who tend to have more testosterone in the body, who then tend to have irregular periods. It often comes with kind of male pattern hair, so they might notice kind of thicker mustaches or some like chin hair, beard hair, or stuff like that. And so that's where a lot of the treatments, and we don't have to get that much into it, tend to be fixing the hormone stuff. And so that's things like birth control pills to try to regulate the hormones. Oftentimes lifestyle things like weight loss and eating healthy and exercising also help to kind of regulate the hormones. And even sometimes people use diabetes medications to also help with weight loss, and a lot of the hormones related to diabetes and prediabetes and insulin also affect your body hormones. So everything is in this very complicated cascade together, but that's generally, I think, the easiest way to think about it. I'm realizing I'm missing maybe some questions in the chat, so maybe I'll just check that really quickly before. Just to go back to clarify about losing your virginity is penetration in the sexual sense. Objects that are not considered sexual cannot be counted or should not be counted, like a pap smear, which is an important medical checkup, exactly, or someone going in to the emergency room and needing a physical exam by a provider. Every now and then, part of the exam includes putting some fingers in, to check the size of a uterus or ovaries or something like that. And so that, should not be considered. Thank you for bringing that up in the chat, I think. And then, yeah. Okay.
Yeah, and they should, they're not tied with this concept of virginity whatsoever. Thank you so much for your answer for PCOS. It was something that was brought up to us recently. And we actually have a couple questions directly from our audience on Instagram. We put out like a little story and people sent in questions. And one of them was asking, is birth control harmful? How harmful is birth control? Just in relation to a past discussion that we had about accessible birth control. So yeah, what's your take on that?
My first answer is absolutely not, because, well, with the caveat that everything has risks and benefits, and there is not zero side effects of anything, but a lot of times there's a lot of benefit. And so generally speaking, most birth controls are extremely safe. And I think if you're comparing the safety of birth control with the safety of pregnancy can be extremely dangerous. And so you might have a little bit of risk of whatever blood clots or something with birth control of a certain type. That risk is, generally speaking, way higher in a pregnancy. And so if that's your comparison, birth control is oftentimes a million times safer. There's a lot of different ones, so it's a little bit tricky to speak generally, but I think we have a lot of experience with a lot of different types of birth control. And the really cool thing is they also can have really amazing side effects. I say side effects, but that can be really wonderful for women's health. And we often use it for reasons not even about birth control. So that's things like heavy or painful periods, birth control can be helpful. Acne, birth control of certain types can be helpful. Even to the point of certain types of cancer prevention can be obtained with certain types of birth control, which is really amazing. And also, along with the heavy and painful periods, some birth control can even stop your period altogether, which I mentioned a bit earlier, but is a glorious and wonderful side effect and cost saving and hassle saving for many women.
Eco-friendly as well. A lot of women.
What's that?
Eco-friendly.
Yeah. I mean, just can be really life-changing. I think especially for women who have a lot of varied experiences with your period. Some people, it takes you out for 2 weeks and you can't work and you can't leave the house. And I have patients wearing 2 pads in a day on top of diapers because their period is so heavy. So if you think about that, there's overall the benefits of birth control are astounding. If anyone is particularly very interested in this, there's I think this book by Melinda Gates just about how, a lot of these global health world ailments would all change with contraception, because it would allow women to go to school and allow, family planning and space pregnancies and change the life course of like billions of women. So I'm a huge birth control fan, if you couldn't tell already.
We at Famalao'an Rights are also huge birth control fans.
Yeah.
So we're on. Our next question, which is actually also our last question for the day, again from Instagram, is kind of the opposite of the question we just asked. So someone asked, so if someone does decide that they want to have children, and they do want to get pregnant and then they do get pregnant, what should they be prepared for? Possible side effects, dangers, things like that. So what can people expect when they get pregnant?
Oh my goodness. Um, that's a great question, and there's probably others on here more qualified to answer than I am. But um, it's, I mean, it's a wonderful thing if that's what you are ready for and planning for. I think, um, I again do a lot of labor and delivery, a lot. I've seen a lot, and it's a wonderful thing. It can be very simple, really straightforward. Women do it all the time. The tricky thing is that when it's bad, it's bad. And I think I take that into all of my consideration, because if it's what you want, it's a risk that people are willing to take. It's wonderful, and it oftentimes is just fine, but it's a huge life decision. It's really the first stress test a body most of the time goes through, but it is a stress test, and the pregnancy is a stress test, labor is a stress test, delivering postpartum, it is like a unbelievable thing that we have been made to do. And so I think it's a perfect thing if that's what's right for you. And if it's not, then I don't think anyone should be forced to go through that, because it's a huge deal. I think in general, again, with most things, optimizing your health throughout your lifetime, but especially pre-pregnancy, is always helpful. So, eating right and exercising and trying not to be too stressed and not taking a lot of drugs and alcohol and stuff like that. All those things will help optimize, but it's I don't know if anyone else has other opinions or has had the experience. I've never been pregnant, never delivered. So this is all my medical piece, but feel free if anyone else has any thoughts.
Yeah, thank you so much, Dr. Shanti. We are just coming in from listening to your interview, and we want to give you a chance to answer the questions first, but you've done a phenomenal job already. Just a couple follow-up questions on side effects of birth control and then giving or getting pregnant. So, like, have you ever had patients that have been on birth control but then had a hard time conceiving because of birth control, or is that something that you can tell that from the birth control, or is it something else?
Yeah. Normally, so with almost all forms of birth control, you can, when it's time or when you decide that you want to have a family, can either be removed or be stopped, and people can try really right away. There's a few, I think a lot of women have kind of irregular periods and irregular bleeding profiles, especially with certain types of birth control. And so sometimes that can make it a little bit tricky, especially if you're thinking about timing. There are certain that you don't necessarily return right away to ovulate, and that's really quite different. But there's not a lot, like, huge differences in time for the vast majority of birth control. So, aside from anything permanent, obviously, like tubal ligation, then that should be permanent. But other forms, IUDs can be taken out, start trying right away. Birth control pills can be stopped, start trying right away. Nexplanon can be taken out. All these things can be, does not really mean that you can't try. And I would say the large majority doesn't lead to issues, aside from kind of really figuring out when, because the irregular periods. Yeah.
I see. So it's just about like stopping the birth control, and then timing is like when you're starting to ovulate regularly again.
Yeah, and that can be, it can be quite tricky, I think, for some women, but I think a lot of women just have such irregular periods to start off with that sometimes it's really quite hard to tell, was it the birth control that had changed it, or was it whatever had been going on beforehand? It really can be quite tricky. We're learning that, there's all kinds of factors, stress changing your menstrual cycle, and a whole number of different things. So it can be really hard to tell, but generally speaking, it shouldn't have a big effect. Yeah.
Thank you so much for that clarification.
Oh yeah. Yeah.
All right. So those are the end of the questions from Instagram, the ones we had prepared. If our audience here from Famalao'an Reds also have any other questions, feel free to ask them. Or if not, then firstly, Dr. Shanti, we want to say thank you. You know how difficult it is to be a doctor, especially during these times. Taking time out of your busy schedule to come and meet with us, to give us really great information that eventually the public will see. It really means a lot to us as a community organization. And I think you have a Futures Famalao'an shirt on. Did I see that
Oh,
right?
I do. I was wearing it.
Yeah.
I got
And
one
indeed,
for me and my sister.
yeah, I thought of it earlier. I was like, hey, that's so cool. Even all the way from over there.
Yeah.
But yeah, thank you. If you have any last closing remarks you want to say, the floor is yours.
Sorry, any last thoughts? Is that what you said?
Yeah, thoughts, closing remarks.
No, I mean, I think one that's completely unrelated, but if anyone's watching this and hasn't gotten their COVID vaccine, my goodness, you need to get it like right now. So I'm just putting that plug in. Guam's doing amazing, so I'm very happy and proud of the island, so that's awesome. But without a doubt, if you can get it 100 million times, you should get it. We are having sick women, sick people, young people, healthy people. It's very bad, so really get it and send me questions if you don't want to or you're scared. So that's unrelated. And I think, there's a lot kind of similarly to with the vaccines, there's a lot of weird information about birth control, and a lot of people have had weird experiences. There's a lot of good and bad, and every person has to decide what's right for you. But in general, if you're ever not sure, ask your provider, ask other people in your life who you trust, because sometimes there's a lot of myths that are often not true. And that goes without saying for all kinds of, not just contraception, but with all kinds of reproductive or just health questions in general.
Hi, Dr. Shanti. That just brings up one more follow-up question. I'm sorry.
Yeah.
For those who are pregnant and waiting to get the vaccine, like what would your recommendation be for those people, for those women or those who identify as women who are pregnant?
Yeah. I have been saying, I think when it first came out, I know that there was definitely a lot of hesitancy, but I think at this point we've had so many pregnant women receiving the vaccine and having no issues that's made, I think without a doubt, I'm telling every single pregnant woman they should. And I think, again, I'm specifically talking about my experience, but on our labor and delivery floor, just in the past few weeks, we have like day after day, women coming in. These are 20, 30-year-old women, and pregnancy is a risk factor for severe COVID. And it is happening. We had someone have to have a premature C-section while she was intubated. And that's something that's for life, that baby's premature for life, and it probably didn't have to happen. So I think ideally we wouldn't have to make this choice, but we are in a spot where we would. So I'm generally telling women that, and I think, the proof of passing the maternal antibodies in the placenta and in breast milk are very encouraging. And so far, every single piece of data we've seen has not shown any concern about the vaccine. So I know everything is always scarier, and you're kind of thinking about long-term effects, but I think just from what we've seen, the vaccine is the least scary option so far. That goes for pretty much everyone, you know, people with medical conditions and allergies and stuff. Is that obviously if we didn't have the choice, then we could not have to make the choice. But compared to, you know, severe COVID, it's an easy choice.
Thank you so much.
Yeah, right, yeah.
All right, well, thank you again, Dr. Shanti. It was really great having you as our very first doctor on the show. So yes, everyone, this is Dr. Shanti Guerrero. I'm Kiana. This is Famalao'an Rights, and this has been a special edition of Famalao'an Talks, and we will see you all next time. Bye, everyone.
All right. Bye, guys.